Times when I worked effectively under pressure. I when I worked in the main OR, I worked second shift, and I was the only LNA, surgical nursing tech assistant, that was responsible to make sure all the OR suites were turned over, cleaned, set up, and who knows, anything that was possibly coming in the future for procedures that day or that night. I had to make sure that everything was set up and all ready for the nurses and the doctors and the incoming patients. I also had to sometimes work two rooms. They needed me to help them get a patient onto a table, help a patient get off. They needed me to go to the lab to pick some things up. And mind you, I was doing two things at once. I would be helping one room and then needed to go somewhere else to get another patient for another room. On top of, who knows, a third room was coming. And I had to set that up on top of the two rooms I was already working with. I guess I was kind of like a gopher. But I did it. But it was an awesome job. I had to do this effectively and under pressure, for sure under pressure. Patients' lives were on our sleeves. They were under asleep or depending what they were coming in for. I remember the one time we had a patient come in. He got stabbed in his leg and he was bleeding out. I didn't stay for the full surgery for that because it lasted around 6 hours. But sad to say, patient didn't make it. But those are the things that I had to be ready for those kind of surgeries and to be under pressure. And it was a go, go, go. And to make sure that everything was set and that if someone needed something, I could get it and they didn't have to come out and stop what they were doing. And that's what I did for as in that position. I was their assistant. They needed something somewhere else on a different unit, in the lab, in sterile utilities. I was the one to go get it or to hand it to them or assist them in the procedure or whatever they needed. But working in the main OR was a constant under pressure, especially when things were going on.